Hey guys, we're going to be talking about antibiotics in children as far as respiratory viral illnesses. I'm Dr. Philip Oob. I've got Dr. Mike Stecher here with me, and he's going to start talking about a study that we've gotten our hands as far as antibiotics in children.
So this is a very interesting topic because I see a lot of kids in the urgent care world that come in with upper respiratory infections, and there's a lot of pressure from parents to put them on antibiotics. And I totally get this because you don't want your child to be out of school. It's very difficult missing homework and having to take off work. But
That's so true. Even in my daycare, they'll say like, oh, you can bring the kids back if
Right.
they're on antibiotics or the doctor says they can. And so that seems strange. We should be encouraged to give our kids antibiotics just so they can go back to school.
So this particular study looked at broad spectrum versus narrow spectrum antibiotics. So antibiotics that cover...
What does that mean, Mike?
Yeah,
broad versus narrow.
Broad spectrum, those are antibiotics that kill a more wide range of bacteria. So they kill a lot of the bad bacteria, but they're also killing good bacteria. So the more broad spectrum it is, the more it's going to damage the microbiome or the good bacteria in the gut.
Give us some examples. What's a broad spectrum one that we want to look out for?
So a broad spectrum would be something like an augmentin or Omnicef, some of the cephalosporins. If you're looking at adult type antibiotics, Cipro might be another, or Levaquin. So those
Clindamycin.
Yes.
Oh, that one's a napalm for the bowels. Okay.
So what the study showed is that if they were giving these children for upper respiratory infections broad spectrum antibiotics, it was no more effective than the narrow spectrum antibiotics, but there were more adverse effects or more side effects from the drug that was causing harm. So it's really showing, in general, we try to limit antibiotic use as much as we can, but if we're going to give antibiotics, we want to go with a more narrow spectrum if at all possible.
Sure. So if I'm a parent and I'm bringing my child to you and saying, I'm worried that this kid needs antibiotics or my kid needs antibiotics, so what are some symptoms to say, oh, it's not time to run to the urgent care yet or to your doctor? What are symptoms that are kind of should cross the threshold for a parent to say, time to take the kid in?
Well, definitely if there's any lower respiratory symptoms like trouble breathing, rapid breathing, shortness of breath, those kind of things. But if all the symptoms are upper respiratory, then as long as it's just runny nose, sore throat, I'm not too worried unless you're getting a really high fever lasting longer than 4 days, you can't control it with medication. Those kind of symptoms are really kind of concerning to me that maybe there's something that's bacterial, or if the symptoms are lasting longer than 7 to 10 days. Less than that, then I'm really not thinking bacterial, I'm thinking viral or maybe allergies.
I agree. And so even though you might have some of those concerning features, it's reasonable to get evaluated, but you still should not have the expectation that you will need an antibiotic. Those are just some of the things that maybe should prompt you to see the doctor. So if it's just a runny nose, just a sore throat, 99% of those are viral infection. And the other thing I often like to point out to my patients is bacteria infect one place, viruses can affect our whole system, right? So if you've got a bacterial sinus infection, you don't also have a bacterial throat infection and ear infection and pneumonia. Bacteria infect one place at a time, generally speaking. Now, unfortunate ICU people can have multiple infections. But in general, in the outpatient world, what we see, if you've got a sore throat and a runny nose and you're coughing and you've got the bronchitis, it's most likely a virus. And it takes time for that mucus to build up and the bacteria to build up in the mucus to develop what we call a secondary bacterial infection.
Correct. Meaning
you started with a virus and now you have a bacteria. So if you get caught in the first 4 days of an illness, it's almost guaranteed it's viral. Unless you have some of those warning signs. Of course, consult your doctor. We're not your doctor on Facebook. So that was a great little study, quick video. Dr. Stecher, thank you. And y'all share the video with any parents that you know that worry about their children or maybe even overtaking antibiotics. Thanks, guys.
Thank you.